Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and we're going to talk to you today about what we call prescription diets. They are diets that either help treat diseases or even prevent diseases. And they'll go from everything from weight loss through diabetes and different things. The first foods that we look at, and this will be on our feline side, this will be the cat foods. This is a food that's called ID, which stands for intestinal diet. And what intestinal diets do are they're for cats that have problems with diarrhea, perhaps vomiting. They're a little bit more highly digestible, so they're much better for these patients when they are having problems of that nature. The next thing we look at are foods that are related to weight loss. WD is a weight loss diet. We have another one called RD, which is also a weight loss diet. And what those are for is they're higher in fiber and lower in calories, so those pets will start to lose weight if they're on the proper diet. We have other diets that get very much more specialized. One is called MD, and it stands for Metabolic Diet. Metabolic Diet is actually for cats and their diabetic standpoint. This is a little bit like an Atkins diet. It's very low carbohydrate and very high protein, so they derive all of their nutrition through a protein source. So it works to keep their diabetes in sync. We have other foods, especially for cats that are itching, scratching at their ears, their head, and they're basically diets that are hypoallergenic, and they have skin support. What this does is it actually has ingredients that the cat has not been exposed to, so they become less allergenic. So hypoallergenic is what we look at when we look for skin problems in our feline patients. When we have older cats, we sometimes find that they start to develop problems that are what we call metabolic problems. One is kidney disease. And when we look for kidney disease, we look at a blood panel, and what we'll find that they have elevations to some of the values that are on the kidney function. What we feed is a food called KD. It simply stands for kidney diet. And what this food does is it lowers the amount of protein, but it gives the kitty the usable proteins that it needs to manufacture everything that they need in their bloodstream, but it doesn't give them anything extra. So it's a sparing effect. It kind of keeps the kidney functioning a little bit better. When we look at other older cat diseases, we find a thing, and this is a very new food, and it's been kind of exciting for our profession, but when we do a blood panel, we actually will look at values, and on this blood panel, Bailey, our kitty cat, she has an elevated thyroid function. So she is hyperthyroidism. What we find is that thyroid gland needs iodine to make its hormone and make these cats hyperthyroid. What this food has done is it is actually so devoid of iodine that it makes the thyroid gland function normally. So it's pretty exciting. It saves cats from having to have surgery, having to have medications, and even things like they do in humans, which is radioactive iodine. So it's actually a very nice thing, a tool that we have. The last food that we use is foods that will prevent or try to discourage bladder stones. And what I've shown here is these are actually what bladder stones look like. They are little rocks, and they are just like a human who gets kidney stones, but with our feline patients, they form in the bladder itself. So they usually have to be surgically removed, but after that we know that about 2/3 of those patients will recreate more bladder stones. So we use foods like this. This is a food from Royal Canin, and they call it SO because it's for the various types of bladder stones that we find as doctors, and it certainly is something that will prevent those stones from forming again. And it is certainly something that if you can create a situation where your kitty doesn't need to have surgery again, it is the way to go, of course. I'm Dr. David Roberts from Manchester West Veterinary Hospital. Thanks again for tuning in.